Most people don't wake up one morning and realize they have cataracts. It happens slowly. So slowly that you adjust without even noticing. You start turning on more lights to read, or you stop driving at night. And sometimes you just blame your glasses prescription. You blame the weather even, or you blame your phone screen. And then one day, at a routine eye exam, your doctor says the word cataracts. And suddenly, all those little things you've been adjusting to and around you start to make sense. So today I want to walk you through the actual warning signs of cataracts. Not the textbook list, but the real ones. The things patients tell me they noticed in the months and years before they realized something was wrong. And then I'm going to tell you when those signs mean it's actually time to think about cataract surgery. My name is Dr. John Legarreta, and I'm a board-certified ophthalmologist and cataract surgeon, and this is Eye Health Central. Let's get into it. Real quick though, so that we're all on the same page, I want to talk about what a cataract is. A cataract is a clouding of the natural lens inside your eye. Your lens used to be perfectly clear when you were young. Over time, and this is usually starting around age 60, sometimes earlier, the proteins in that lens start to break down and clump together. The lens turns yellow, then amber, and then in some cases brown. Light has a harder time getting through this clouded lens. Your vision gets dimmer, hazier, and less sharp. That's what we call a cataract. And here's the important part. Cataracts are not a disease you catch or a problem you cause. They are a normal part of aging. If you live long enough, you will get one. The only question is when and what you do about them. Now let's talk about what they actually feel like. Sign number 1, halos and starbursts around lights at night. This is usually the first sign people notice, and it's the one that scares them the most. You're driving at night. The headlights of oncoming cars don't look like clean white circles anymore. They look like sunbursts, streaks shooting out in every direction. Street lights have rings around them. Brake lights bloom and smear. What's happening is that the cloudy parts of your lens are scattering light rays instead of letting the light pass cleanly through to the back of your eye. Your retina is getting the same headlight, but spread out into a halo. This often gets dramatically worse over a few years. People then stop driving at night. They stop going out to dinner with friends. The world gets smaller without them really noticing why. If headlights and streetlights are scattering across your vision at night, that's a cataract talking. It's time to get it checked out. Sign number 2, colors look faded or yellowed. This one is sneaky because it happens so gradually that most patients don't notice it until after surgery, when suddenly everything looks vivid again. A cataract starts off clear, but as it develops, it turns yellow and then amber. So your entire visual world is getting filtered through a yellow tint, and you don't even realize it because your brain has slowly adjusted to the color change. The way I usually catch this in patients is to ask, when you do laundry, are whites getting harder to tell apart from off-whites? Can you still tell navy from black? And when you see a blue sky, does it look as blue as it used to? Patients who've just had their first eye done often come back stunned. They cover the unoperated eye, and the world is bright through their new vision. Then they cover the operated eye, and the world is yellow and dim through the eye that didn't have surgery. That contrast is very shocking. But it had been like that for years. They just hadn't seen the comparison. Sign number 3, your prescription in your glasses keeps changing. This is one of the most underrated early signs. You've worn the same prescription for years. Then suddenly, every time you go to your eye doctor, your prescription is getting different. Your distance vision is changing. You're getting more nearsighted. Reading is getting harder, and then easier, then harder again. What's happening is that as the lens inside your eye thickens and changes shape from the cataract, it's actually changing your refraction or your prescription in your glasses. Some patients temporarily become more nearsighted with early cataracts, sometimes to the point that they can read without their reading glasses for the first time in years. Some people call this second sight, and they often celebrate it. It's actually a warning though. If your prescription has changed twice in 2 years, ask your eye doctor specifically, is this a cataract starting? Sign number 4, you need more and more light to read. Reading lamps used to be a nice to have. Now they're essential. You can't read a menu in a dim restaurant. You're holding your phone up and using the light built in. Or you've bought a brighter bulb for your nightstand, then bought an even brighter one. This isn't just aging eyes. Yes, everyone needs more light as they get older, but a sudden accelerated need for brighter and brighter lights is a sign of cataracts. The cloudy lens is absorbing and scattering light before it even reaches your retina, so you need much more light coming in to get the same image. If you've changed 3 light bulbs in your reading area in the last 2 years and it's still not bright enough, that's a sign. Sign number 5, bright sunlight feels worse, not better. And here's the paradox of cataracts. You do need more light to read indoors, but bright outdoor light becomes painful and disorienting. Patients tell me they can't see when they walk out of a building into the sun. It just really blurs out their vision. Everything washes out. They have to stand still for a few seconds while their eyes adjust. Driving into a sunset is extremely difficult, and snow glare or beach glare is very overwhelming. What's happening is that bright light hits the cloudy lens and scatters light in every direction, creating an overall haze that washes out your vision. So in a dim room, you don't have enough light, and in bright sun, you have too much chaotic light. Both are bad. If you started avoiding bright outdoor environments, that's not just sensitivity, that can be a sign of a cataract as well. Sign number 6, double vision in one eye. This one surprises some people because we usually think of double vision as something of a more serious condition. But cataracts can cause something called monocular diplopia, or double vision in one eye, even when the other eye is closed. You see a faint shadow image next to letters. Headlights look doubled. The moon has a faint twin. It happens because the cloudy lens is splitting incoming light in 2 slightly different paths. Your other eye, with its better lens potentially, doesn't do this, so the double vision goes away when you cover the cataract eye. If you're seeing ghost images in one eye, get evaluated, especially if you can confirm it goes away when you cover that specific eye. Sign number 7, faces are getting harder to recognize. This one is emotional, and patients rarely bring it up first because it makes them feel old, but it does matter. Let's say you're at a family event and you look across the room and you can't tell which grandchild you're looking at. You don't recognize a friend at a grocery store until they're really up close. Or you're watching TV and you can't tell which actor you're watching. Cataracts reduce contrast, the ability to distinguish subtle differences in shading. And faces are made entirely of subtle shading. So when contrast goes, faces go with it. If you're feeling socially withdrawn or embarrassed because you can't recognize people anymore, this is not necessarily a personality change. This can be a vision change, and it can be fixable if it's due to cataracts. Okay, so you've got some of these signs. When is it actually time for surgery? Well, the honest answer surprises a lot of people too. It's not based on how bad your cataract looks on an eye exam when I take a look at it or your doctor takes a look at it. It's based on how much it's affecting your life. 2 patients can have cataracts that look identical to me through a microscope. One is a retired homebody who reads in a sunny living room and has stopped driving at night anyway. He doesn't need surgery yet. The other is a 65-year-old who still is working as a real estate agent, driving clients around at all hours. She needs surgery now. Same cataract, different lives, different needs. So the questions to ask yourself are these. 1, have I stopped doing things I used to do because of my vision? Stopped driving at night, stopped reading, stopped a hobby. 2, am I feeling unsafe? Have I had a near miss in the car, a fall, or a misjudged step? 3, has my work or independence been affected? 4, have my glasses been updated and the problem still isn't solved? If you're saying yes to any of these, the conversation about surgery is on the table. That doesn't mean you have to do it tomorrow. It means it's time to talk to a cataract surgeon and understand your options. And I want to address the wait and see instinct because it's strong. A lot of patients tell me they want to wait until the cataract is really bad before doing anything. And I understand that. Surgery sounds scary and avoiding it sounds prudent. But here's what I push back on. Waiting doesn't make the surgery any easier per se. It can actually make it harder if you wait too long. A denser cataract takes more energy to remove and carries slightly more risk. Waiting also means living with worse vision for longer. and that can have real cost. Falls, car accidents, social isolation, depression. None of these things are small. The right time isn't when the cataract becomes unbearable. The right time is when it's affecting your daily life and you benefit from clearer vision. That moment is usually earlier than people think. So, if you're sitting with this video right now, thinking about your own eyes or about a parent or grandparent, here's what I want you to take away. The signs of cataracts aren't dramatic. They can be very quiet. Halos at night, yellowing colors, changing prescriptions, brighter lights, faces you can't quite place. If those things are creeping into your life, the next step is simple. Make an appointment with your eye doctor and ask them directly, do I have cataracts? And if so, are they affecting my vision enough to consider treatment? You don't have to commit to surgery just by asking. You're gathering information. And the earlier you have the information, the more time you have to make the right decision for you. If this video helped you connect some of the dots, hit the like button and share it with someone who's been making excuses for their vision lately. Sometimes people just need to hear what they're experiencing has a name and a fix. Thanks for watching. I'll see you in the next one.